Okay, well, welcome everybody to the Cannabis Research webinar for April. Thank you for joining us. We're going to get started shortly, but first I'm just going to allow a couple minutes for additional people to sign on. I see that the number of attendees is steadily going up, so I'll wait a few minutes before giving the initial introduction. Give it just a couple, maybe half a minute. I still see a couple people coming on here as the top of the hour rounds. Okay, I think we could get started. So hello, my name is Jeff Smith, and I'm the Interim Director of the Institute of Cannabis Research at Colorado State University, Pueblo. Welcome to the research webinar series, which is presented by the Institute of Cannabis Research and the Lambert Center for the Study of Medicinal Cannabis and Hemp at Thomas Jefferson University. This webinar series, in collaboration with the Lambert Center, is one of the many ways that the ICR works to promote the dissemination of cannabis research. For example, please see our website, which can be found by Googling the words Institute of Cannabis Research. From there, you can navigate to our Outreach tab and find the current e-newsletter, or you can navigate to the Research tab and view summaries of each of the research projects that the ICR currently funds. We're also happy to report having received a record number of letters of intent for new research applications for potential funding in the next fiscal year. The ICR needs scientific reviewers to help evaluate the scientific merit of these proposals. So please contact the ICR if you are interested in serving as a reviewer. You can also find information about our future monthly webinars. Also on our website, please note the link to the Journal of Cannabis Research, which the ICR sponsors. The journal is published by prestigious Springer Nature and is always looking for both high-quality scientific article submissions and reviewers. Finally, we will be hosting the ICR's 7th annual Cannabis Research Conference next August in beautiful Denver, Colorado. And we're very happy to announce having approved a record number of abstracts this year. Registration is open, so please register for our conference and come learn about the very best current cannabis science. Additional information about the ICR is also available on our website, so please visit us. Before we get started today, I just want to mention a couple logistical items for the webinar. The presentation will be followed by a short question and answer period. If you want to ask a question, please do so using the Q&A feature in the Zoom toolbar. You can enter your questions at any time during the presentation. We'll address as many questions as time allows at the end of the hour. Please reserve the chat function in Zoom for technical issues and questions about technical problems. Both the Q&A and chat functions can be found in the toolbar on your Zoom screen. It's now my pleasure to introduce my colleague, Ruth Charbonneau, the Associate Director of the Lambert Center, who will be introducing today's presenter and moderating the webinar.
Thanks, Jeff. Today we have Dr. Jessica Kruger. She is a health educator whose research focuses on consumption and addictive behaviors, health behavior decision-making, and pedagogy in public health. She collaborates with a wide variety of community-based organizations and advises students at the Lighthouse Free Medical Clinic and the Seneca-Babcock Community Center, both in Western New York. Dr. Kruger is the Vice Chair of the Board of Directors for the Society of Student-Run Clinics and focuses on increasing the interprofessional collaboration in free clinics around the U.S. She also serves as a member of the leadership team of interprofessional education and collaborative practice at University of Buffalo, where she is a clinical associate professor in the Department of Community Health and Health Behaviors. With that, I welcome Dr. Kruger and look forward to her presentation.
Thank you very much. Happy to be here. and very excited to talk to you about alternative cannabinoids. And today I'm going to focus on our research in Delta-8 and give you a little teaser about what we have coming out with THCO. So today I'm going to focus on just a quick overview, making sure everyone has the same working definitions. Talk a little bit about our Delta-8 study and the results of these two publications that we have out, and then move into THCO. And I really hope our conversation in the question and answer talks a lot about what needs to be explored, because there's so much with these that is yet to be uncovered. So alternative cannabinoids, or altnoids, as they are used, or the term that is used colloquially, hemp derived, and they're either extracted from the hemp plant or altered from other cannabinoids. And really how this came about is because the Farm Bill created that loophole to where if we didn't have a concentration of Delta-9 below 0.3%, we'd be able to have these be legal. And I'm in New York. And so for the last few years before legalization, we had just a huge rise in people using Delta-8 because it was available and it was legal. And that's what we're seeing in many places. I often get calls from folks in places who don't have Delta-9 legalization wanting to talk more about Delta-8 because it has become such a large product that's out there. Now, this is a very short list of the alphabet soup that I just want to bring up when we talk about alternative cannabinoids. So HCC, Delta-10, THCO, THCP, THCV, and the list goes on and on. I feel like every day there is a new alt cannabinoid that is becoming very popular, or at least talked about, whether it's in the news or in various channels. So much happening in this area that can and needs to be explored. I'm going to focus now on Delta-8. And Delta-8, we really didn't know much about it when we first started this research. We knew people were using it, but we didn't know what the effects were compared to Delta-9 THC. So as you can see at the top of this page, Bison Botanics is a distributor of Delta-8 THC and CBD within our local Western New York area. And while I've never partnered with industry before to do research, it has been so delightful to work with this group of folks. And Bison Botanics is really the reason that we were able to collect the sample size in which we did. Oftentimes people get a little squirmy when you talk about working with industry, but in fact, I feel like they interviewed me more than I interviewed them, really wanting to make sure that we weren't just out there to ask people in the population questions that could possibly be harmful, but that we're doing good, right? And our intentions were to find out more and give people this information. And it's been really nice because they were able to reach the population in which we studied. So we are forever grateful for our friends at Bison and being able to inform us about what they're seeing with consumers. So I just want to bring that to light because oftentimes we don't see that kind of a symbiotic relationship occurring. So what I'm going to present to you are in two different papers. One is in the Journal of Cannabis Research, and the other is Cannabis and Cannabinoid Research. All of this research was conducted with my collaborator and life partner, Dr. Daniel Kruger. So Delta-8 is an isomer analog of Delta-9, and we see this found naturally in very low concentrations in Delta-9. But because it has a lower affinity for the CB1 receptor, we don't see kind of the potency effects that we see with Delta-9. Now, it can be synthesized from other cannabinoids. So we have a challenge here when you don't know where it's coming from. Is it coming from Delta-9? Is it coming from CBD? And so it's one thing to think about and keep in the back of your mind as I'm going through this is making sure that what people are calling Delta-8 is actually Delta-8. Really one of the fastest growing segments in the hemp industry in 2021. And it continues to be widely used and widely sold. Before we started our research, like any good scientists, we went out there and tried to find what was done. And there wasn't much. In fact, really a small study in 1973 where they said that it was about 2/3 as potent as Delta-9. And then in 1995, a small sample with pediatric patients. And some of the results were that it was a more stable compound, the Delta-9 THC. And so this really got us thinking, what are people using Delta-8 for? Is this medicinal? Are they switching out medications in which they've been using pharmaceuticals? We need to know more. And just for all my chemistry folks out here, here's the different structure of Delta-8 and Delta-9. So we believe all policy and practice should be informed by science. I don't think we should be making decisions just from knee-jerk reactions. We really need to understand what is happening and how people are using different products. And so we really want to, whatever research we do, conduct broad surveys to inform policies, regulations, practices, and look at all sides of cannabis, the costs, the risks, the harms, and the benefits, and really being kind of holistic in our approach. And so the survey content had been informed by previous studies in which we have done with Delta-9 THC. And we were able to work with our partners at Bison Botanics to recruit our study population, mostly through social media and email contact lists, which were provided by Bison. Our survey was anonymous, and we were collecting from June to August 2021. So we had about 521 respondents. This sample, I feel like, is pretty standard for most samples that we see in cannabis research. And I really want to draw to the point that, you know, we have a very white population with this. And this is something that I really hope changes over time as we're learning more and more about who's using cannabis and reaching various populations. We really need to think about reaching more diverse audiences. All of our participants were from the US, and you can see we have a larger percentage from New York, but we also had folks from all over the country with 38 states in total. And 90% of the states where Delta-9 THC cannabis products were not commercially available for adult use without medical recreation. So you can see that Delta-8 definitely is being used by folks who maybe don't have access to Delta-9 at the time. So we ask about how folks were using Delta-8, and you can see majority are edibles, right? And we often hear with Delta-9, that's not the case. People tend to, edibles seems to be lower than vaping or smoking. But the reason why smoking seems to be far lower on this is oftentimes Delta-8 is sprayed onto an herb, not actually the bud or flower. And so that's why it's a little bit lower here. Vaping concentrates are very ubiquitous, tinctures. And so from a public health standpoint, I love the fact that less people are smoking this product and more people are eating it. I'll talk a little bit more about some challenges with vaping when we talk about THCO, but I think it's really interesting to know the consumption, routes of consumption. So 83% of our population reported consuming Delta-9. And this was interesting because we wanted to have a comparison between what people felt with Delta-9 and what people felt with Delta-8, since not much was known at the time. And with over 50% of folks using it to treat a health or medical condition, this really brought our attention to, folks who may not be able to get Delta-9 for medical conditions seems to be turning to Delta-8. 29% of the above use Delta-8 exclusively to treat a health or medical condition, so not for recreational use. And we see a large percentage of folks substituting for pharmaceutical drugs. And as a health educator, substitution is something that's really fascinating to me, but also somewhat worrisome depending on what sort of drug is being substituted for. Is this something that needs to be titrated down? Or is this something that could be stopped? Also see a large percentage of folks substituting for Delta-9. So they actually chose Delta-8 over Delta-9. And we reported 22% that their primary care provider knew that they use Delta-8. And that was 31% for those reporting medical use. It's so low, right? And it's because of all the stigma, right? All of us on here understand that, and it can be really challenging, especially when we know that many physicians don't know much about cannabis in general, let alone when you tell them a different number or a different type in which they may not be aware about or have learned about. So we wanted to know the experience with Delta-8. And what we found is folks tended to say that they felt pretty relaxed. They got a lot of pain relief from this. But unlike its counterpart, Delta-9, they had far less anxiety and paranoia and difficulty concentrating. And I'll show you a comparison in just a minute about this. But it really seems to be a benefit to Delta-8 that it doesn't have that anxiety or paranoia that's associated. When we compare Delta-8 and Delta-9, we're seeing that the intensity and duration seems to be slightly different, right? And so Delta-9 seems to be more intense, and the duration seems to be nearing about the same, but perhaps Delta-9 lasts a little bit longer. Of course, this is self-report, so just an interesting difference in the two. When we look at comparing Delta-8 and Delta-9, we see that relaxation, pain relief are about the same for the two, with more paranoia and anxiety with Delta-8, so kind of that inverse that we saw. And so this is really kind of a unique finding when we're talking about this product of why people may choose to use Delta-8 over Delta-9 for removing some of those negatives that some can have when using it. So it's always interesting to me what folks are using this for. So the health and medical conditions being treated. And so of that subsection of the population in which we studied, 246 were using this for health or medical. And we're seeing the primary and then other percentage. So we ask, did you use this for your primary medical condition, and what other conditions did you use? So that's why we have those two percentages there. Highest for anxiety or panic attacks. And so we can kind of see that in the profile of it, that it's less likely to be anxiety or panic inducing. A lot for pain. You see depression and bipolar. Stress, I think, is something that we see folks saying that they're often using cannabis for, a reduction in stress. Headache and migraine, sleep, back pain, and then arthritis. And so when we look at that and the other percentage, right, we're seeing a lot of people co-using of anxiety and stress, things like that, of saying those are the conditions. So whenever we look at the medical uses of cannabis, we always refer to what I jokingly call the Cannabis Bible, the health effects of cannabis and cannabinoids by the National Academies of Science. And I think this text does a really nice job of outlining the evidence for medical effectiveness in which we have. And so here's a table just showing whether the evidence is conclusive or substantial or not sufficient, or maybe even limited evidence. Now, I will note this is a few years old, so I'm sure we have more knowledge out there, which is so exciting. And I look forward to the next edition of this so we can update our table with more evidence being found. So when we look at this and compare the health and medical conditions that were being used for Delta-8, and we overlay what we have empirical evidence for and what we don't have empirical evidence for, you can see this a little bit differently. So chronic pain, yeah, we have evidence for that. Not so much for depression, but yeah, for sleep issues and insomnia. Other conditions, a longer list, irritable bowel syndrome, we don't have, at the time we didn't have sufficient evidence by the National Academies of Science. I do know that there's more research coming out now, which is great to see. But nausea, yeah, something that we have research on. Our list continued, so anything relating from sciatica to movement disorders, to some of those chronic conditions that we see, diabetes and hypertension, which could also be under the category or causing the patients to have additional stress. TMD, TMJ, appetite. So again, many of these are not supported by evidence in which people are using, or evidence that we had at the time. So with this substitution, and I mentioned this in the beginning about substitution, to where I think this can be a really good thing and a really scary thing, depending on what people are substituting. And so we asked folks, have you ever used this? And past use, have you reduced your use or stopped your use or substituted? And so you can see the percentage. Many people use alcohol, it's pretty ubiquitous. I always think we should have asked caffeine here, but alas, I will maybe another study. And so with things like alcohol, CBD, antihistamines, even NSAIDs or tobacco, these could be seen as, pretty quick switches or reduced or stop or substitution. But when I get into the area of antidepressants, that's where I start to get concerned if people are reducing, stopping, or substituting, because many of these need to be titrated down. They need to be done under the supervision of a physician. And with only 31% of our population saying that are using it for medical use, that their physicians know about this could be a huge public health problem, especially if they're having withdrawals from the medication or having some other adverse effects because of the substitution or reduction. Also see with opioids, a lot of research out there with reduction of opioid use for Delta-9. It seems to be occurring with Delta-8 also, because of the profile seems to have some pain reduction without some of those negative side effects that folks might see from anxiety, paranoia. But when I see benzodiazepines, again, this is kind of a double-edged sword. If someone's taking benzodiazepines for anxiety, many of these need to be controlled as people are reducing the amount. I sometimes worry about people substituting or stopping, but it seems that some of these drugs might be better if you're not always on pharmaceutical drugs. And we ask people about pharmaceutical drugs and cost and effectiveness comparing with Delta-8. It's kind of an interesting way to look at it. Again, another one that really worries me is antipsychotics and anticonvulsives. So things that I keep in the back of my mind as a public health professional that sometimes keep me up at night as people are switching out these pharmaceuticals for cannabis. I really hope we have far more research on this in the future. I think this is a really ripe area for folks to really look at some of these specific medications. So when we're comparing Delta-8 to pharmaceutical drugs, right, it seems to be less side effects for folks. You know, they don't feel as though they're getting as addicted, less withdrawal symptoms, higher effectiveness. They feel like this is safer than the pharmaceutical drugs, and the availability might be better for them. Cost, especially if folks don't have insurance, this could be a more cost-effective solution. Although we see about the same for social acceptance with this. So I think if we were to ask this question 2 years from now, I'd be really interested to see how that social acceptance changes. Another thing that kind of raises my spidey sense as a public health professional is always where people are getting their information about Delta-8. Prior to our publications, there really wasn't much outside of some of these popular sources. So the internet, right? We all know everything on the internet is correct, not so much. Many people were finding information from their own experimentation and experiences. Others were asking employees where those products were sold, and I'm going to put a big caveat there, as Delta-8 can be sold in many places, including gas stations. So if you're asking a gas station employee about the product, that could be a problem, right? The packaging, which often doesn't have much information, and very few are getting information from primary caregivers. Things in the other category would be like scientific literature. And I think that's just because it didn't really exist. There wasn't much out there. So I think we have a huge opportunity here to really educate folks about the potential of using Delta-8 for medical use, but also for really expanding people's understanding of the substance. How confident are you in your primary care provider's ability to integrate medical marijuana into your treatment? And we really see that folks are not very confident in that, right? And this seems to be, we ask this in folks who use Delta-9, Delta-8. It seems to be a question that we continually ask because it's interesting to see how this shifts over time. But again, I get where people are coming from. If you tell a doctor that you're using Delta-8 or a physician, they may have no clue what you're talking about just because they're not taught about this. And this is another opportunity that I think we really need to take in training our next generation of healthcare professionals, not only about just cannabis in general, but alt cannabinoids, and having a lot more continuing education related to this. So we also asked some qualitative questions, and this is where I've never had survey participants write in the comments so many times that they're so thankful that someone was studying this. And that's really powerful, I think, to people want to know more and they wanted to be part of this process. And so do you have any comments? And do you have any comments about the topics in this survey? Were two questions that we really looked at. And so these are just some of the kind of main themes that we pulled out here. A lot of positive aspects for Delta 8, relaxation, pain experience, pain relief, and euphoria were really the things that kind of came out from the qualitative results. Folks said they reported a lot lower cognitive distortion and very low levels of anxiety and paranoia. Some of the comments related to this made me a little bit nervous when folks said, I could wake up, use Delta 8 and go to my job. I'm hoping they're walking to their job. But again, these are some of the things that they feel as though they don't have some of that couch lock, they don't have some of that brain fog that they see more with Delta 9 use. People really compared Delta 8 favorably with both Delta 9 and pharmaceutical drugs, with a lot of folks reporting that drug substitution, which again, could be a really great thing, could be somewhat of a challenge. I think we need more research on this and more understanding of how people are substituting. And one continual theme that in many ways worries me for folks who are using this medicinally is the continual concerns about the legal aspect and legal access to Delta 8. If someone is using this for a medical condition, there was a lot of comments on concern about being able to access this, but also accessing products that they knew were tested and safe. So as we continue to make legislation around all cannabinoids, I think we really need to understand how many people are using this for medical purposes and what are the ramifications if this becomes illegal. So kind of to wrap all of that up, there are really favorable experiences compared to Delta 9. Again, with that lower anxiety, lower paranoia, less brain fog. I think there is a potential for this to provide therapeutic benefits with some less adverse side effects like paranoia, anxiety, brain fog. And so with the two past studies that were done in more of a medical framework, this could be considered for medical use. And you can see by the participants, people are already using it for medical use. There's a lot of substitution of both pharmaceutical drugs and Delta 9, right? So this, many folks seem to use both. And with that really low physician awareness, that's a huge problem, right? I work a lot with a variety of healthcare providers. And when I say Delta 8 to someone, they just look at me because they're not taught this, right? They're not taught the difference between Delta 8, Delta 9. If you throw a THCO in there, they just lose it. So this is a huge opportunity. We recently have done some work in looking at dental students' knowledge because in fact, cannabis can have major effects on if they're doing oral surgeries. And so it's not only physicians, it's all healthcare providers. With all products that are synthesized, I really think we cannot underscore the concern for purity and contaminants. And many of the consumers really want to know what they're using. People want to be informed. People want to be able to scan a QR code and see what is in their product. And so I think we definitely need to make sure that that's available for folks who want to use it. Of course, this is a survey, and with all surveys, there are limitations. But we really need to continue beating that drum of we need double-blind, randomized clinical trials to really confirm some of these effects in the comparison of Delta 8 and Delta 9 and the profiles. And as any good health educator and public health professional, I really feel so strongly that we need cannabis education at all levels, not just for healthcare providers, not just for people who are consuming, but anyone. This has become part of our culture, and a way to reduce stigma is to educate folks. So I'm going to switch gears to THCO just for a few minutes. This is hot off the press. I was telling folks before this, I actually have to submit this manuscript right after this call. So this came about, the THCO research really came out of a collaboration in which I have, and I'm so thankful for, that's interprofessional, interdisciplinary, just a cool group of folks. We have a few anthropologists on our team. We have a chemist, we have a biologist, we have a psychologist, and myself and another public health professional. And really, when you put us all into a room and make us start thinking about these things, we come up with some really neat ideas to look at some of these alt cannabinoids, particularly THCO, which has continued to be on the rise. This is just a small section of a larger study that we did looking at THCO. And I'll preface THCO with, this has really become popular, and many marketers are saying THCO is far more potent than some other alt cannabinoids like Delta-8 or even Delta-9. I've also seen things out there that say like THCO, it'll reset how much tolerance you have for THC. This is all driven by marketers. This is not driven by science whatsoever. And so we really wanted to dive into this and learn a little bit more. From a harm reduction standpoint, we really started worrying about THCO when it came to dabbing and vaping because of the risk of ketene formation. So one type, this is a THCO. THCO is actually THCO acetate. And it is now a Schedule I controlled substance as of February 2023. So like I said, hot off the presses that this has changed. Previously, this fit in a legal loophole where Delta-8 was. And so ketene formation, I'm going to try to bring you back to something that was very relevant in the news with vitamin E acetate, the Valley issues. And what we see with this is it can occur, ketene forms when you're heating acetyl acid and its derivatives. You can see the little bit of a difference between that carbon bond. I am not a chemist. Our chemist friend tells me all of this, so please trust me on that. A highly reactive and potentially hazardous chemical, which we heard about with Valley and the irritation in people's lungs, and even the term of popcorn lung that began to be circulated. And I think that really gave vaping a bad name when this all was occurring. And oftentimes as a public health professional, I like to talk to people about different ways to use. And one is vaping, which can be safer than smoking in many cases. This may be that caveat case. So we took a little bit of a different approach with this study and actually recruited on Reddit. One of our members of our team is very into the Reddit community and part of the Reddit community, and is even a moderator for some of these groups. And so we reached out to them and asked if we could put our survey on their Reddit page for their folks to take the survey. And you can kind of see some we didn't get a response to, some said no, but we had a good portion say, yeah, please do this. And we had a pretty substantial response, over 1,000 folks. And like I said, this is really one small section of the survey, but I really think this needs to get out there sooner than it might take for publication. But folks, if they expressed a preference for dabbing or vaping, we asked them a question about temperature associated with their dabbing and vaping. And so not everyone knows the temperature of their vape or dab rig. That is a problem in the reporting of this, but this is something more than we've had previously. And so the temperature values are higher with dabbing than vaping. You can see the temperature range difference. And with this, those temperature ranges can actually have considerable risk for ketene formation. So this could be that caveat. This could be that challenge with saying that vaping could be a safer alternative to smoking. We need more information. And we're looking more into this on our team. Our chemist is fast at work doing some studies in the lab. But I think it's something that I think is really important when we're talking about alt cannabinoids, to think more about some of this when it comes to different, not just delta-8, but THCO, THCP, right? We're learning so much more. And so this could really have some potential risk if people do not know about temperature, right? And it's also an opportunity to provide some of that education around, can you use this at a lower temperature? Do you know what temperature you are using? Or do you have a rig in which you could change the temperature and use at a lower level? With THCO, we also worry about contamination risk. We really need some solid research on longitudinal studies, how people prefer using this, how much they're using this, and biological examinations of toxicity based on dosage. So much more needs to be looked at with THCO. But I think it's going to be a real challenge with Schedule 1, right? We all have the challenges of studying cannabis in general, whether it's Delta-9 or another component. So I think we have our work cut out for us there. So with that, I'm going to stop, and I'm excited for questions.
Thank you. So let's start with from your earlier part of your presentation, but the question relates to understanding your results correctly in your survey about why people use delta-8, and that 51% of respondents use delta-8 to treat a medical condition, but a higher percentage, 59%, use delta-8 as a substitute for a pharmaceutical drug.
Yes, yep, that's what our results say. Now, interesting, right? In that difference, again, survey results. The data are what the data are. I think some people's interpretation of that question could be construed differently.
With the survey, did you question whether they were naive users or sort of how much knowledge or use they had of cannabis in the past?
No, I don't believe that we've asked how much. I think that could also, be a challenge if you've used it but one time, right? Do you fully have that experience? Maybe not, right? And I think that's something a colleague of mine is really working on a highness scale, which I think also kind of goes into that measurement of the difference in which you feel. Is this the first time? Is this the way in which you're consuming it, right? Many different variables there, I think, that could be explored.
This question is, isn't smoking a higher temperature than vaping in relation to the ketone formation?
Say that again.
Isn't smoking a higher temperature than vaping?
We were comparing dabbing and vaping. So I am unaware of the temperature for smoking. And I'm happy to get back to you on what our colleagues who do some of that temperature risk would have to say.
This goes back to the sort of education component. So there's a lot of discussion about what is appropriate to be on a label of products, and recognizing that many patients or users are not going to look at the certificates or broader research. Should there be more information about terpenes or delta-8 that are on the label that patients or consumers get at the point of sale?
We actually have a paper out on labeling in CCR, and I think this is a really challenging area because I think big cannabis industry can make really fancy labels, right? They have the ability to just create these graphics and put it all in there. But folks that are home growing may not have that ability to put all that information on something that's typed. And we have to think about what is the most important to get to consumers. Now, I'd love if we got to the point where we had kind of this pullout, but I don't know how many of you have read the pullout on Tylenol recently, right? So even if you are someone who wants to be informed, I think the other side of that is how that information is presented is not always the most accessible. I look at some of those QR codes and like, oh, okay, that's interesting. I'm not sure how to interpret that. So I think we really need to look at that some more. Especially we know our population has a low health literacy rate. How does that play into some of these labels? But they definitely need to be more accessible, more available for those who want it, but also keeping in mind folks who are not maybe in larger industry.
How much is known about Delta-8 toxicity, effect on liver function, etc.?
I think we're learning more and more now. That actually just came up when I was talking to a colleague about Delta-8, right? With some of these biological effects from Delta-8, it's going to be interesting to see down the road when we could track people longitudinally. I'm a survey researcher, I'll tell you that. I wish I knew some more of the negative biological effects, but I think we'll see it, right? And it's been really inspiring to see how many more papers have come out about Delta-8 since when we published in 2021. So it's definitely on the minds of researchers.
And did you have a sense as to whether the products were legal or illicit market products?
We did not. So we did know that folks who were buying from Bison, that was legal at the time. In other states, it wasn't legal. Right. The legislation on Delta-8 seems to change like the wind, just as many other legislations around cannabis do. And so I can't speak to yes or no and purity, how was it really Delta-8? Did you have something else? I think that's all really challenge with self-report and survey data. So I'd love to see this really done in a double-blind clinical trial, gold standard. But I think we'll have to wait a little bit for that.
In one of your charts, you had the substitution that sort of individuals were using the product for, and there's a high number on opioids. And so was that a one-to-one substitution, or were they, using both, were intermittently? Did you have a sense as to how that was being substituted as specifically to the opioid?
I wish we had more data on that, because I've seen more and more studies look at, cannabis as a substitution for opioids. And we didn't ask to the point of like, we asked if you stopped, right? Did you reduce, but we didn't say how much, right? Is this a one-to-one? Is this you use a little bit more of cannabis than you do of opioids? Is this all the time? Is this occasional, right? And so that's a really neat area that I think needs to be explored, because this could really have some life-changing effects, as we know how the opioid epidemic has affected so many.
As a harm reduction strategy, is cannabis being discussed as sort of an alternative?
For opioids?
Yeah.
There's definitely studies out there that are looking at that for harm reduction. And I think that is one area in which harm reduction in cannabis has really kind of taken hold, right? I do a lot of work with different modalities of use and having conversations with folks about how can you use cannabis in different ways, vaping, eating, even using it topically so that you're not smoking it, right? Smoking a joint, a blunt, a bowl, and then also setting some of these myths around harm reduction in cannabis that we see on the different websites. I think my favorite debunked harm reduction strategy is putting ice in your bong as a harm reduction strategy, not backed by evidence, but people still think that's something out there. And we do have a paper out on harm reduction and cannabis and people's knowledge of it. And it's sadly an area in which we need a lot more education around.
Just going to your practice area in terms of interprofessional education, when individuals were asked, very few felt comfortable that their primary care providers would have knowledge. But is there a sense that, again, are they using other providers? Is there a physician versus nurse sort of comfort level with speaking to patients about cannabis, or is it what I would say is sort of our organized way of training physicians, nurses, and other healthcare professionals versus those that have been in practice for some time? Is there a comfort level that varies?
I wish I had an answer for you on this, but it'll start me on a soapbox rant about our healthcare system and the challenges with it. I think first of all is how we ask the question, right? We don't do a good job asking about people's use of substances. In the past, we've asked, do you use any illegal substances? Like, no, I don't want to tell you that I use anything illegal. No, I don't, right? I think we're getting better in the way that we're asking that question of, do you use any other substances besides alcohol and tobacco? I personally work in a free medical clinic every Friday night, and with our population, we do ask if you smoke anything. And that seems to be a nice kind of jumping off point. And it allows for some conversation if people are using cannabis, if they know other ways in which they can use, also providing a little bit of education around where are you getting your product? And is there something that you would like to know? We're here. And it's so refreshing when I can walk into a room and have that really open conversation with someone because I've allowed them the space to have that conversation versus, are you using anything illegal?
Just in terms of that patient base, is there sort of a variation in ages when you're having that conversation, young versus middle-aged versus older?
Seems to be across the board, which is really interesting to me. The modality of use, I've just anecdotally seems to be slightly different across the age groups. Our younger folks tend to, smoke joints or blunts. Our older folks tend to use more edible products or topicals. So it's a nice opportunity to have a conversation about, oh, you don't like edibles. Okay, well, what don't you like about edibles? Have you tried using a rig in which you could set the temperature versus a vape cartridge? Are you interested in changing the way in which you're using and respecting where they are, right? But most of the time, I find that people are just excited for someone to listen to them and answer their questions because they often don't have that opportunity to ask those to a healthcare provider.
This goes back to an earlier comment, but cooling hot air, ice in the water pipe is not a strategy for reducing harm from the heat-related risks of smoking. Sure, it's not a risk reduction strategy for particulate matter, but it does reduce the temperature.
I could see that, but I have no evidence showing that it's a true harm reduction strategy. And I think you could probably, have a deeper conversation on where you want to draw the line on what is harm reduction, right? Is heat reduction harm reduction? I don't know, but in the truest sense of, I know that this will reduce your harms of consumption. I don't feel that that has some conclusive evidence, but I'd love to see more studies on this.
Just using Reddit as a sort of survey tool was interesting on the number of groups that participated. And so was there anything unique about that population in terms of survey response?
Yeah, the anonymity of Reddit is a great opportunity to learn some really unfiltered information. And the nice part is, because our colleague is part of these Reddit groups, we were able to use the terminology in which these Reddit groups are using, which I think is really unique and key in cannabis research. If I'm using a term that doesn't make sense to the consumer, I'm not answering the question in which I'm seeking out to find. And so one example is the term that I recently learned, boof cartridge. So that means in the Reddit community in which we've been working with, a cartridge that does not contain what it says that it's containing. So if it says that it's Delta 8, it could be something else, or a very little amount of that product. And so there's a lot of conversations in those communities that allow us to learn more about not only how and what people are using, but how they're describing what they're using and how they're using, so that we can appropriately explain that in a survey question, versus using my language, which could be very public healthy, making sure that people understand the question. And so that's been a really fun, unique opportunity. And working with our team of folks, with some anthropologists, they've done some ethnographics, and really kind of mapped the way in which people talk about these products, and even their use, which has just been eye-opening. So I really think our group does a really nice job of meeting the community where they are, and also asking the community of folks who use these products what they want to know, and then going down that path, and always providing that information back to that community in a way in which they can continue to learn.
Have you purchased any of the products people are using to determine if they really are Delta 8 or some sort of mixture?
Our colleague who's a chemist has purchased many of these products, and we're working with some facilities to figure out more testing. Not my side of the house, so more to come.
And the products are primarily from New York, or from, you've looked at different states?
Yeah, our colleague is actually in Portland.
Okay.
So looking at a totally different area.
Well, I think we're approaching the top of the hour. So I want to thank you for a very interesting discussion and timely. So we'll look forward to your publication and further studies. So thank you.
Thank you.